I think there are a couple of key takeaways for me in this report. The first is just having a real solid estimate of how large the public health workforce is and the diverse kinds of activities and duties that public health nurses have was really, really important and provides some real depth of understanding that we haven't had before about what public health nurses do, ranging from, I think everybody thinks of public health nurses as being the people that give the baby shots, give the immunizations, do that maternal child health work. But what this report shows is that they really are doing work across health departments, doing a lot of community health promotion and prevention work, doing a lot of administrative work in departments, not only with nursing, but as directors of local health departments, and in one or two cases, state health departments. The other key takeaway was the importance of public health nurses continuing their education and making sure that more and more that we see public health nurses as being prepared educationally for the jobs that public health needs to have done. And in order to do that, they really need to have bachelor's preparation for entry into practice in public health. You know, there's tremendous transformation going on in public health and in healthcare. And I think by 2020, we're not going to recognize the healthcare system or the public health system as we know it today. So I think what's happening with some of the changes with the Affordable Care Act, increasing the amount of the population that's covered, in many places, we're going to see many health departments getting out of some of the direct care business. And I think at the same time, there'll be other things that public health departments will be doing that they're not doing now. So to the extent that these transformations that are taking place, the reorganization or realignment of health departments with the needs in their communities, as long as these things are being done in a way that involves the community, that is clear and transparent to the voters, the residents of these communities that are being served by the health departments, the policymakers, then I really don't have concerns about the changes that are taking place. Well, I think that compensation and opportunities for promotion are always key in recruitment and retention of any part of a workforce. And so they're highlighted in this report as definitely needing attention by policymakers and agency directors for public health nurses across the country. And I think they're tremendously important. But what the report also shows is that public health nurses are very, very satisfied with their job. They feel that they're making a big difference in the lives of their communities, their community members, families, and individuals. And they're also voicing in this report that they really, as a professional group, they really do have a tremendous amount of both responsibility for their practice and autonomy in their practice. And I think that these three factors, the satisfaction, the autonomy, and the responsibility for their practice, are all things that perhaps in other settings, nurses don't feel that they have as much control over, are as able to make such contributions to an agency's mission. So I think these things from the report kind of stand out and really can be leveraged in terms of recruiting and retaining public health nurses at an agency level. I say they definitely should do it. I've been a public health nurse or been in this arena for over 30 years, and it's been a blast. I think what has come through in my career, and I think is spelled out in aggregate in the report, is that there's been a tremendous amount of different kinds of opportunities for public health nurses, ranging from different populations to work with, different settings, the ability to do things that range from working with individuals and families up to having an influence and an impact on public policy, all to the point of trying to improve the conditions of people's lives and improve their health. So I think public health and public health nursing is just a fantastic place to have a career, and there's tremendous opportunities there. So I would encourage anyone that is going into nursing to definitely take the path of going into public health nursing.